disease is a very interesting series of diseases that are related to the supporting structures of the tooth. They probably have a causative factor of being related to bacteria that are on your tooth surface, but they're really the response of your body to those bacteria. So it's really an inflammatory disorder rather than a bacterial infection. So what destroys the bone structure is your body's response to those bacteria. So I imagine it is if you stick your splinter in your finger, you end up getting swelling. And if you pull a splinter out, you're going to get a little bit of pus. If you hit your finger with a hammer, it's also going to swell, but it's not an infection, it's an inflammation. That's what goes on in the mouth. You get a slight amount of bacteria, which stimulate a response in your gum tissue, which leads to a loss of the supporting structure around the tooth. So that ends up, over time, destroying what holds the tooth in. I think from a patient standpoint, what's really frustrating is at times you can't tell. There's very seldom pain. So do I have patients come in that are in pain? Not usually, except when they get an acute exacerbation, $9 word for it swells up and then they know something's wrong. But bleeding of the gums when you brush is one good hallmark that there's something unusual going on. You've at least got the start of something that's causing a response in your gum tissue. The other thing would be a tooth that becomes suddenly loose. Didn't used to be that way. Pain when you chew in certain areas could mean that you have gum disease. But the best way to do it is of course consistent dental appointments where they measure the depth of the distance between the top of the gum and the top of the stuff that holds your tooth in, which is the bone. The most important thing for the treatment is knowing if you have value for your teeth. You want to keep your teeth, so you want to treat them to keep them long term. That would be, I would tell any patient, that's the best thing to do. Keep your teeth. However, it does have a systemic effect on you. So these bacteria go to many places in the body. If you find them any other place besides the mouth, especially the ones that are found only in the mouth, you know you've got a challenge. So it can cause things like cancer. In fact, in males, pancreatic cancer, over 60% of the cases now have the Porphyromonas gingivalis, PG, bug in their pancreas. And it causes lots of other problems in other diseases, but direct cause for things like rheumatoid arthritis, anything that's going to increase your your body's response to getting hit by the hammer on your finger, that's the kind of thing you want to control and why you want to get them treated. So save your teeth, protect the rest of your body. That's really what you're after and the reason you get it treated.